You ever wonder how a doctor takes this jumble of symptoms, a patient's confusing story of aches and pains and worries, and somehow transforms it into a clear, precise diagnosis and a real plan of action? Well, it can seem like magic, but it's not. It's actually a masterclass in detective work, and today we're going to uncover exactly how they crack the case.
So that's the central mystery we're diving into. How do they make that leap from a chaotic story to a specific solution? I'll tell you this. It's not just guesswork. It is a highly structured investigative method that the very best clinicians use to solve even the most complex cases.
And this is their secret weapon. It's called the Integrated Physician's Workflow. You can think of this as the 7-step map that guides a doctor from symptom to solution. It's the clinical detective's investigative playbook, and it's broken down into 2 main parts.
Okay, so the first part of any good investigation, right? It's all about collecting and structuring the clues. This is where our detective takes the raw, kind of messy story from the patient and turns it into clean, usable data for their case file.
This first phase has 3 key steps. First, they gather all the data from what the patient says and what they find in a physical exam. Then, and this is key, they translate that story into a specific clinical language. And finally, they synthesize it all into one powerful summary.
But what's really interesting here is that step 1, gathering data, it's not a passive thing at all. The doctor isn't just a sponge soaking up information. Their deep knowledge of anatomy and physiology acts like a searchlight, guiding their questions, guiding their exam to find the most relevant clues. So if they suspect a heart problem, they know to ask about swollen ankles, because physiology tells them that's where the evidence might be hiding.
All right, so once they have all this raw data, they need to clean it up. And they do this using something called semantic qualifiers. These are just precise, binary terms that filter the noise from the signal. You know, is the problem sudden in short term, which is acute, or has it been going on for months, making it chronic? Now, this isn't just jargon. It's the fundamental way they structure information so it can actually be analyzed logically.
And you can see that translation process in action right here. A patient might come in and say, "My whole leg is red and hot." Well, the clinical detective hears the 4 classic signs of inflammation: redness, heat, swelling, and pain, and translates that into a very precise pathological description, a lower limb inflammatory process. The messy story has just become structured data.
So the crucial point is this final step of part 1, the problem representation, or as they call it, the one-liner. This single sentence, it synthesizes everything: the patient, the timing, and the clinical syndrome. A strong one-liner is so powerful that an expert physician can often guess the top 3 potential diagnoses just from this sentence alone. It is the input that fuels the entire diagnostic engine.
Okay, moving into part 2, we can start to see how this all built. Now that we have our clean, structured data in that one-liner, the detective's work shifts from just collecting clues to actively solving the puzzle. Now, this second phase has 4 big steps. First, building a list of suspects, which is known as the differential diagnosis. Then, filtering through those possibilities with tests. And then, crucially, pausing to reflect and check for errors. And finally, creating the action plan.
When a diagnosis isn't immediately obvious, how do doctors make sure they don't miss something really important? Well, they use safety nets, like the Vindicate mnemonic. This checklist forces them to consider every single major category of disease, from vascular to infectious to autoimmune. It's an incredibly powerful tool to prevent tunnel vision and make sure the investigation is thorough.
So, with a list of suspects, the detective now needs to start eliminating them. This is where tests come in. Each test result acts like a piece of forensic evidence, either increasing or decreasing the probability of a specific diagnosis, and they keep testing until the likelihood of one disease is so high that it crosses what's called the treatment threshold. That's the point where they are confident enough to act.
This is such a critical question in any investigation, right? We're all human. We're prone to error, we can get stuck on our first idea, or we might stop looking for clues way too early. So how do expert clinicians protect themselves and, more importantly, their patients from these kinds of mental traps?
Well, they do it with a deliberate diagnostic pause. This is step 6, a moment of metacognition, of thinking about your own thinking. The doctor literally steps back and actively checks for common cognitive biases, like anchoring bias or premature closure. They'll ask themselves, okay, does all the evidence really fit my theory, or am I ignoring a clue just because it doesn't match?
And once the case is solved and the diagnosis is confirmed, the final step is to put together the plan. Now, this isn't just about prescribing a pill. It's a comprehensive strategy with 3 pillars: therapeutic actions to treat the underlying disease, supportive care to manage the patient's symptoms, and disposition, which is deciding the safest place for the patient to be next, whether that's at home or in the ICU.
So we've walked through the 7 steps, but the real secret here, the real magic, isn't just the workflow itself. It's the mindset of the person who's using it. It's about how they think during each and every step.
You see, what's really happening in an expert's mind are 2 parallel tracks running at all times. On one track, you have the science, that foundational knowledge of why the body works the way it does. And on the other, you have the reasoning, the active process of how to solve the problem. The true expert seamlessly integrates these 2 tracks at every single step of the way.
And that brings us right to the core idea. The expert physician isn't just some technician following a protocol. They are a clinical detective, actively using this workflow to solve problems based on the fundamental, indestructible laws of human biology.
So the next time you find yourself telling a doctor your story, listen closely. You might just recognize the signs of an investigation in progress. Are they just collecting facts? Or are they a detective on the hunt, meticulously turning your story into a solution, cracking the case one clue at a time?